everybody. Welcome. My name is Kim, and I am from We Speak Student More Care, and I'm here to talk to you all about Cambrian International Student Insurance. So I'm going to go through what your insurance is today, how you can actually use it, some extra perks available to you, and then I'll open it up to questions. So it's going to be fairly, casual. It's a small but mighty group we have today, which is great. So one thing I do want to start by saying is if we can please hold questions until the end of the presentation, that would be greatly appreciated. I will be available after the presentation to answer questions. So if we can just hold them until the end, that'd be great. Most of the time, I'll answer your questions while I go through the presentation. Also, I do want to remind you that this is a public webinar. So I really recommend keeping any personal questions to yourself, and then I will show you how you can access our contact center to ask personal questions too. So anything that has to do with personal claim questions, personal, coverage questions about your own health status, I really recommend keeping that for a private question and answer opportunity with our call center. Again, this is public and it is being recorded. So it will be sent to the school and, publicly uploaded. So just a reminder there. So if there's any personal questions, please do reach out to our contact center after the presentation. All right, let's get right into it. So rather than going through a PowerPoint presentation for you, I prefer to go through the website. I'm going to go through the website today. This way, you'll be able to access all of these, different coverage informations and claim informations directly from the website, and you'll have a step-by-step kind of guide to get you there. So I'm just going to share my screen when I find it. There we are. All right, I'm going to share my screen. We're going to get going. So this is morecare.ca, and this is Cambrian College's page. So you can get there by going to wespeakstudent.com or morecare.ca. I know sometimes it's confusing when you see the two names. Morecare is specifically for international students. So that's why you'll see on your international student benefits card, it says Morecare. That is because it is for international students. We Speak Student is for all students, and that includes lots of different coverages too. So let's just get into it. So this is the website. You're going to see that there are two options. There's Cambrian Domestic and Cambrian International. Today, we are here talking about international insurance. So I think we all know that the correct answer would be clicking on the orange if I asked you which one should we go to. So let's just get right into it and click on international insurance. So let's get into the coverage information. So we're just going to start right with the international OHIP alternative. If we were in person, I would say something along the lines of, have you ever heard of the term OHIP before? Someone might raise their hand, some might not. But OHIP stands for Ontario Health Insurance Plan. And this is the primary healthcare plan that Ontario residents have for us to access, hospitals, doctors' offices, blood tests, etc. So we, along with Cambrian, has created an OHIP alternative for you as an international student to have access to also at Cambrian College. So you will be able to access, doctors' offices, hospitals, blood tests, x-rays, all that kind of stuff, just like an Ontario resident would. So this is, various informations here. There is $1 million lifetime benefit maximum. What that means is you have up to $1 million to go to a doctor while you are a student at Cambrian. You'll see here that there is, various information on, hospital visits. Those are covered, doctor visits, medical services and devices. But there are some maximums within the $1 million maximum that I do want to make sure that you are aware of. So there is maternity coverage if you were to get pregnant while studying at Cambrian, and there is a $25,000 maximum for pregnancy within that. So that is more than enough for a typical pregnancy. There is a maximum of $25,000. There is also a maximum of $10,000 for psychiatric hospitalization, $10,000 for self-inflicted injuries. There is $25,000 for oncology treatment, which is cancer treatments. There's $20,000 for repatriation, and then $15,000 for return home. Hopefully you really won't need to use any of that coverage at all and you stay very healthy, but it is good to know that it's there. I also really want to make sure that I explain what return home benefit means. It unfortunately does not mean I really miss my family and friends. I want to go home and visit them and I have $15,000 to do it. As wonderful as that would be, it is not the case. What it means is if you were to get so severely ill that the only option is for you to return home and seek medical attention there is $15,000 for us to get you home. This would be at the discretion of a doctor, and the doctor says that it is the only option. And then we at More Care would help you get back home. We would make sure everything is organized for you and paid. Again, I really hope no one ever comes down to that. I hope you don't have to use that part of your insurance, but it is good to know that it is there. All right, let's get into other areas of the coverage. So, OHIP alternative, that is just one type of coverage, but you'll see for the health and dental plan, there's actually two options for you to choose from. So there is the typical health plan, and then there's also a dental focus plan. Seeing as it is November 22nd, the opportunity to change your plan has come and gone. So if you did not do anything whatsoever at the start of the school year, then you would automatically be on the health plan. If you did change to the dental focus plan, then you, of course, would be on that plan. If you do not change this year and you want to change, you will have to wait until next September in order to change. You are only able to change once in, the policy year. And that is your starting semester. So for those who are on the health plan, which is the typical health plan, you have $5,000 for prescription drugs covered at 80%. So, if your drugs were $100, it would be covered 80%. So $80 would be covered, and then $20 would be out of pocket. Most prescription drugs are included. Insulin supplies, if you are diabetic, is included. Allergy serums, vaccines, oral contraceptives, those are all included within the drug plan. If you have any prescriptions that you were on in your home country and you want to have those here in Canada, what you will need to do is you will need to go to a doctor here in Ontario. Just tell them that you're on, prescription XYZ and in your home country, and they'll be able to give you the Ontario equivalent. If you change to the dental focus plan, you do have $500 maximum for prescription drugs, and they're covered at 50%. All right, if we continue going, we'll go to dental. So if you did not change your health plan at all, sorry, we're just going to hold our questions until the end. Sorry if you came in late. We're going to hold our questions until the end of the presentation. Thank you. Most of the time they get answered, and if not, I promise I will be able to answer them at the end. All right, so if you are in your dental, if you are in the dental focus plan, you do have dental, and you would have $400 maximum per student year. I want to just remind you what the policy year is. So the policy year is from September 1st. So of this year, it would be September 1st, 2021 to August 31st, 2022. So when I'm talking about all these maximums, that's what it's referring to. If you were to then continue in September 2022 in an additional year of studies, then your maximum will go back to zero and start again. So again, if you are not in the dental focus plan, you do not have dental benefits, but if you are in the dental focus plan, there is a $400 maximum. I also always recommend, if you're going to the dentist, to ask the dental office for a quote, so you are very aware of how much you will be needing to pay out of pocket. All right, sorry, we got a lot of latecomers coming in right now. I'm just getting distracted letting them in, but there we go. We'll continue on. All right, extended health. So the extended health benefits, that is, paramedical practitioners. They are, whether it be naturopaths, chiropractors, massage therapists. I'm not going to read through everything because, as you'll see, there's lots of information here. But it is great to know that you do have extended health benefits, and they are all covered at 80% unless otherwise indicated. So if you are on the regular health plan and you did not change to the dental focused plan, then you have 100% per treatment to a maximum of $500 for all of the paramedical practitioners listed here. And then if you are in the dental focused plan, you have 50% up to $250 for those same practitioners. If you keep scrolling down, you'll see that orthopedic supplies is covered. Ambulance is covered at 80%. This is always good to know that ambulances do actually cost money for international students and domestic students or residents. It typically runs around $250 if you need an ambulance, between $250 and $300. So that would be 80% covered. The other aspect would be paid out of pocket by you. So of course, if it's an emergency and you need an ambulance, absolutely call and get one. But if you're able to get somewhere without using an ambulance, I do recommend leaving those ambulances for people in urgent need. So there's various equipment rental included, medical supplies, prosthetic appliances. So take a look through here. If you're ever unsure or you're not sure if something's covered or you want to know something more about, a specific coverage detail, please reach out to our call center, which I will show you how to do shortly, and they'll be able to help you every day from 8 a.m. to midnight. If we keep scrolling down, we have vision coverage. So if you are in the regular health plan, it is 100% covered for $150 for lenses, as well as one eye exam. If you're in the dental focus plan, it's $100 per lens, per prescribed lenses, and again, one eye exam. You will notice here that it's every 24 months. So that is different than the other coverages. So everything else, as I said, goes back to zero come the new policy year. But vision is different, it is every 2 years. So if you were to go and get your eyes checked today, which is November 22nd, 2021, you would not be eligible to get vision coverage claims paid until November 22nd, 2023. All right, accident benefits. These are not the most fun things to talk about, but it is good to know that it is here. There is accident benefits available for you. So life insurance is included within that, accidental medical expenses, emergency taxi, rehabilitation. So again, this is everything to do with an accident. So if you're ever submitting a claim and it is in regards to an accident, please make sure on your claim form that you do say, yes, this is an accident, so that you are paid out for the additional accident benefits available to you. Travel coverage. So, travel is slowly but surely coming back. Hopefully, you all had safe travels to Canada when coming for the school year. And hopefully we'll be able to start traveling more soon. But you do have travel coverage available to you. There is a lifetime benefit maximum of $5 million. This is when you are outside of Ontario and your home country. So this is available everywhere in the world outside of Ontario, and it is not valid in your home country. So one thing I do want to mention is that if you were to find yourself in a hospital outside of Ontario, then please make sure to call the number. It's listed here, but it's also on the back of your MoreCare card. Please make sure to call that number within 24 hours to let them know that you are at a hospital, and then that will give the insurance company the opportunity to negotiate with the hospital to make sure that nothing needs to be paid out of pocket on your part and that all of your claims are paid promptly. Last but not least, we have a wonderful student assistance program called WeConnect. This is in addition to your extended health coverage. So this is wonderful 24/7 telephonic, multilingual, confidential counseling and support program. And I will show you how to use that very shortly. But it is 24/7. And so you might not need, support from a counselor today or the second, but it's good to know that it is there and available to you when and if you do need it. All right, so that is all of your coverage details. I know I just threw a lot of information at you. I'm now going to show you how you are able to actually submit your claims. So before we do that, I'm just going to go through this, kind of bar here. So you will see COVID-19 pandemic MoreCare updates. A very common elephant in the room is, this covered through COVID? Are there any exclusions? I'm happy to tell you that there are no exclusions. This is all covered just as, an Ontario resident coverage would be covered. So with testing, I know that's a very common question, is COVID testing included? If you have symptoms of COVID and you require a COVID test, absolutely is covered. If you are traveling and require COVID tests for travel, that is up to your discretion to be choosing to travel, and you would need to pay out of pocket. And that goes the exact same for me as well. So if you do click here, you will see that there is a frequently asked question document on our Facebook page. And this is updated as we receive information as well. So we receive information from the government when everybody else does, but we try to do our due diligence to keep everything in one place. So this is information on how you receive COVID testing, what's covered, how you receive the vaccine that is government funded, so you don't need to worry about that. It talks about the reopening plan, travel restrictions, whatever you need to know. But there are no exclusions for COVID-19. If you find yourself hospitalized because of COVID-19, that is covered under the plan. All right, let's move on to the booklets and forms section. So when you click here, it will bring you to the Your Space page. So there is lots of information here, as you will see, and it's very important that you always click on the International Student tab. So it brings you to this booklets and forms section because you do have different coverage than domestic students because you have the OHIP alternative coverage and the travel coverage, which is a little bit different. So you'll see here that there is the travel insurance card. So if you are traveling, please do, print out this card, save it to your phone, make sure you just have this information on hand if and when you need it. There is also a international student insurance booklet. I say this is really good bedtime reading if you're having problem falling asleep. It's a very long, very in-depth look at your coverage. But if you're looking for some more, detailed information, this is available to you. I'm going to clean this up a bit. There we go. Now on this side, we have various forms. So you're going to see that there is drug claim form, vision form, extended health form, dental claim form. So there's lots and lots of forms available to you on the website. And you can submit those forms. But the main form that you will be using is the 2021-22 International Medical Claim Form. So you will click here, and this is the form. So you can submit all claims on this form. So you're just going to put in your information. This is your fillable form. So you would just put in your name, your information, your student ID, put in all of your information, your telephone number, email address, Canadian address, and just go through the form and complete everything that is asked. So you'll see here that, you just have to say what your claim is about. So let's say you went to the doctor because you hadn't been feeling well. You just say, walk-in clinic visit, put the amount of the charges. And then again, as I said, if it's an accident, make sure you say yes. And finally, you would need to go to the end, click either payment to be made to the student, which would mean that you paid out of pocket and you require those funds back, or payment is to be made to the hospital, which means that the hospital or clinic gave you an invoice and then you're submitting the claim on their behalf. You would then have to attach all original invoices and receipts and email them to claims@morecare.ca. As I said, we do have a contact center that is available every day. So if you're having issues filling out the claim form, please reach out to them and they can help walk you through it. So I'll continue on here. So the student medical card, there is a student medical card available to you for you to print out, for you to save to your phone. And I recommend doing that if you haven't done it already. All you have to do is put in your date of birth and your student number, and it will generate automatically online. You can save it on your phone. We have a MoreCare app as well, so you can download the MoreCare app, and you can make sure that you save the card on your phone into your Apple Wallet. This is what you would show when you were at the doctor's office, when you are at the hospital, if you're at the pharmacy or the dental office. They would be able to take this card and put all of the information through for you so that you don't have to pay out of pocket. You'll see here that we do have a discount network. So there is wonderful discounts available to you all throughout Canada. And there is also a provider map. So this provider map, this shows you all of the locations that take the MoreCare card, which means that they provide direct billing options. This is not to say that you cannot go to another hospital or doctor's office. It's just possible that you might have to pay out of pocket and then submit a claim form after. So please don't get confused. This provider map is just simply telling you where you can go without having to pay out of pocket. But if you need to go to a hospital, just go to the one that's closest to you and we will make sure that you get your claim paid. If you look here, there's various coupons. Who doesn't love coupons? Save some money. One of my favorites is the save 10% on products and prescriptions at Shoppers Drug Mart. So take a look at your coupons there. There's some helpful videos here about submitting your claims and tutorials. And finally, a feedback form. So you'll see here on the feedback form, there's a phone number as well as an email that you can access our call center. There is also a live chat. So as I said, we do have a contact center available to you every day from 8 a.m. to midnight. They can help you with claims inquiries. They can help you letting you know exactly what your coverage dates are. If you're unable to, access your More Care card for whatever reason, then you can ask them and they can help you with that. If you have a question about your coverage, or if you aren't really sure where to go for, a doctor's appointment or where to start, they can help you as well and make sure that they set up direct billing for those appointments too. So give us a call, send us an email, or reach out on chat. I assure you it is a real person there, and they are able to help you in real time. One thing I do want to mention as well, that the website does come in various other languages. I unfortunately just speak the one language, so that's what I'm going through with you all today. But if one of those other languages would be more beneficial to you, you can absolutely access different languages. So let's go back to the front page. So we'll go back to Cambrian International. And so this gets us back to the front page. So we just went through all of the Cambrian International information there. We went through the claim forms, we went through what your coverage is. Now there's a couple additional pieces of information here as well. So you actually can submit some of your claims online. You cannot submit your travel or OHIP alternative claims online. You would have to email those in. You actually can create an e-profile and submit claims online so that you can actually get paid direct deposit. So this is actually a wonderful, very, very easy step-by-step information of how you can submit claims online, how you create your profile, and also what claims you can and cannot submit online. So you would just click here when you are ready to create your profile, register. You're just going to go through that one time, go through the various steps, put in your banking information so you have direct deposit, and then that's all you need to do. If you were a November start student, I'm not sure if we have any November start students here, but if you were a November start student, you do have 11 more days to opt in your family. Unfortunately, if you were a September start student, you are not able to opt in your family anymore. But come next September, you would be able to do that too. And this is where you do it here on the front page. So as I said, we do have a call center. Please call us with any questions. I'm going to end on the topic of two additional things. So one is virtual doctors. So you see this here in the corner here. It is exactly what it sounds like. It is doctors that you can see virtually. And they are accredited doctors, and it is totally direct billed. So no funds are required out of your pocket. So if you click here on virtual doctors, you're going to have to make an account one time, and then you'll be able to access a doctor within minutes from your computer or from your phone, whatever is easiest for you. I recommend using this as your first step to all doctor's appointments because they are able to, provide prescriptions. They are able to refer you to specialists. And of course, if they do think you need to see someone in person, they will let you know as well. So if you don't have a family doctor yet, I really recommend using the virtual doctors. It's the easiest. And this way you don't have to go into a doctor's office if you don't have to, which in my opinion is really great. I personally have used it many times, and they are a wonderful service. So please do use the virtual doctors if you are feeling unwell and aren't sure where to go. And last but not least, WeConnect. So this is the student assistance program that is available for you. As I said, this student assistance program is a mental health resource where you can speak with counselors every day of the year, every hour of the year. They are available. So you would simply click here, and you'll have to create a one-time account, and then you will be able to access all of the information. That being said, if you were to go back to the international page and click on the student wellness program, the information is also here. If you don't want to create an account, you absolutely don't have to. You can simply call the number and they will be able to set you up with a counselor immediately. They also have a lot of wonderful things on their website. They have a lot of great articles. They have a lot of great, blog posts, but you can also, get coaching, for other things. So there's life coaching available to you. There is, you can speak to a nutritionist, legal counseling, financial advising. So please, please, please do reach out to WeConnect if you're looking for any type of support. And there is no additional funds required from you either. This is all included in your health plan. All right. I just gave you lots of information to chew on, so I'm going to stop sharing my screen. I know that some people did join a bit later, so I'm just going to kind of remind everyone that I am now here to take questions, but I really do recommend keeping any personal questions to yourselves and reaching out to our contact center. This is being recorded and it will be publicly, posted. So anything personal, please reach out to our contact center and they'll be able to help you. So I'm going to take a look at the chat function first. I think that's typically the easiest way to ask questions. So I'm going to look for the chat function first. And then Paula, I see that you have your hand up. So I will make sure that I answer all the chat questions. Then you can let me know your questions afterwards. So someone said, I filled a claim form and submitted all supporting documents to the MoreCare email address, but haven't received any update yet. It's been 4 weeks. Do they let us know if they have received our documents? Great question. So I think you received just a generic email saying that your email has been received, but no, we don't follow up with each individual claim form. Typically, claims can take up to 4 weeks because you are getting a check mailed to you. So sometimes, unfortunately, it is at the discretion of the mail service. Also, make sure that you are checking the mail at the address you put on the form. I know that sounds silly, but you'd be surprised the amount of times people are living at a different address, but they put a different address on the form, so the mail doesn't come to their exact address. If you would like an update on your claim, please do reach out to our call center and they can give you an update. Someone said, could you comment on the physician section of the form? Sure. So that's the second page of the form. In an ideal world, you'd have your claim form with you and you go to the doctor and they'll be able to help fill out the physician's record. But let's be honest. We probably are not bringing the claim form with us everywhere we go. So that second page, if you're unable to fill it out, that's no problem. Just fill out the claim form to the best of your ability. And if the claims department requires further information, they'll be sure to reach out to you or the physician for further information. Someone says, can we have access to a family doctor? Absolutely. You can choose your own family doctor. Again, if you're unsure of where to start, reach out to our contact center and they'll be able to kind of point you in the direction of somewhere, in your area. Someone said, please clarify on the family opt-in. So you are able to opt in your family within your starting semester for the first 30 days. So if you were a September start student, you would have been able to opt in your family from September 1st to September 30th. If you were a November start student, you are able to opt in your family from November 1st to November 30th. Unfortunately, if you were a September start student, you're not able to opt in your family at this time. But you are able to opt in your family if you are a November start student. Simply a reminder what your family is. It is your spouse or children. Unfortunately, your siblings or your parents are not able to be added as dependents. Someone said, I looked at the provider map. Is it only one walk-in clinic to access? So if you were looking at the provider map and you were looking, I guess, maybe near the Cambrian location, there is, a few walk-in clinics in that area, but you can access any of them and then pay out of pocket and then get reimbursed. Also, there's different clinics available in different areas of the province. So if you find yourself in different areas, other clinics might be on that map. But please remember that the provider map does not mean you cannot access other areas. These are just areas that take your MoreCare card. Okay? So you just might have to pay out of pocket and then submit for reimbursement. I do understand that in Sudbury, there unfortunately are not many clinics that do work with third-party insurance companies, and which is what we are. And so you will have to pay out of pocket and then submit for reimbursement. But I promise you that you will get your reimbursement, no problem. If you're ever concerned of going to a doctor and having to pay out of pocket, please reach out to us and we can set up a doctor's appointment for you. So I see some very like specific questions about certain testing. If you have specific testing that you're wanting to inquire about, please reach out to our contact center and they'll be able to let you know kind of what's included based on what your needs are. You typically require, referrals for these types of testing. So if you have received that referral and it is required, it's considered medically necessary, then it would be covered. But a lot of these things are kind of case by case. But if you do need a vaccine for, work or study, so if vaccines are required, for your school, then they are covered up to $150. But if they're required for work, again, that would be something that would be under your description. It's covered up to, you have vaccine coverage up to $150. But the rest you would have to pay in pocket. The COVID vaccine is government funded. So at this time, there is no fund required from any individuals seeking the COVID vaccine. Someone said, can you provide the contact information for the online doctors? So that's actually just on the MoreCare website. So I'm gonna hear, I'll just write it in the meeting right now. So if you can go to wespeakstudent.com, click on Cambrian, and then make sure you click on the virtual doctors tab when you get there, and then you will be able to access virtual doctors. There you will also be able to access everything else you need, our contact center, submitting claims, etc. Okay. Someone said, how much time do we have to send the forms to reimburse? If I need to get an eye evaluation, do I contact the virtual doctor? Great question. So the virtual doctor is just a doctor for your primary health. So that is a physician. You can't access an eye doctor online. You would need to go in person. Typically, you do have to pay out of pocket and then get reimbursed because eye doctors are different than family physicians. Eye doctors are, of course, specialized for your eyes, and that would be your vision coverage. But the virtual doctor questions whether you're having long, and also how much time do you need to send the forms to reimburse. So I would recommend if you are seeking a certain practitioner or whatever that might be, try to submit your claims as soon as possible so you don't forget. But you do have 6 months from your initial appointment to submit the claim, or November 30th of the following year, whichever comes first. So right now you have 6 months, but let's say it's July 2022, and you go to the eye doctor. And from this policy year, you would only have until November 30th of 2022 to submit. All this information is on the claim form, and you'll be able to make sure that you are updated there. Someone said, if I need prescription drugs because I have a previous disease, do I contact the virtual doctor? Yeah, you absolutely can contact the virtual doctor for prescriptions. So if you have a prescription that you had back in your home country and you need it here, you would simply say, I was on prescription, whatever that prescription was in my home country. Can you please provide me the Ontario equivalent? And they'll be able to do that. And someone said, how can we get this recording later? I'm in a class. I will be sending the recording to the international office. So however they choose to get this out, I will let them kind of answer that. But you reach out to the international office probably, by the recording and be able to post it wherever you typically do. Someone asked regarding family opt-in, does my child or dependent get a separate card? Good question. You actually can use your card. They don't need a separate card. You will receive an email when you opt in your family with all of this information. And you will receive an email that does have a dependent card, but honestly, you don't need it. They can just use the same card as you because they are on your plan. Oh, perfect. Thank you, Tara. So Cambrian is going to post the recording in the iSent app. Someone said, so if I need an eye doctor, I have to go and pay and then get reimbursed. Yes, so you will have to pay out of pocket at the eye doctor appointment and then pay, and then you can submit your claim and get reimbursed afterwards. It's very uncommon for eye doctors to allow direct billing. Someone is asking about specific coverage dates. As long as you are a full-time student, you would continue to be covered. As I said, your coverage runs from September 1st to August 31st. So, if you need further information on that, I recommend reaching out to our call center to confirm your exact coverage dates. But, you should be covered continuously between studying, because you would continue to be a student. But if there is kind of a big chunk of time that you're not in school and you aren't paying fees, then no, you wouldn't be covered. But I recommend, if you're having specific coverage inquiry details, reach out to our contact center. They'll be able to tell you your exact coverage dates. And if you need further information, you can reach out to the international office to make sure that you are in fact enrolled when you need to be. Someone said, if my kids need annual evaluation by a pediatrician, how do I get an appointment? And if my kid also needs their vaccinations, where do I get them? So again, if you are unsure where to start, reach out to our call center and they can set you up with a doctor. They can also, kind of recommend places in your location. But you can also reach out to the virtual doctor. They're pretty helpful. I'm not sure what vaccines you're referring to, but if you're referring to COVID vaccines, you can go to the government website or to our COVID-19 FAQ page on the website. And they can let you know there as well. All right. Someone said, does our optical insurance under Morker also cover sunglasses? So it's just prescription glasses that is covered. And thank you for posting the number. That's great. I really recommend, going to our website. That has all of the information you need. It has the phone number. It has the our chat service, it has our email, and it has all the information that you might need as well.
Can I ask my question?
Absolutely.
Okay, I opted for the health insurance plan, but I also want a dental coverage. Can I buy another from another part, like a dental coverage?
Well, you would have to, unfortunately, we don't sell, individual insurance. We do group insurance. So if you were a September start student, unfortunately, you're not able to change your plan now. You would have been able to have changed your plan within the first month to the dental focused plan. But unfortunately, if you didn't already do that, then we aren't able to change your plan mid-semester. So you can reach out to individual insurance companies, but unfortunately, if you have not changed your plan, unfortunately, we can't be changing it 3 months in. Sorry.
Okay, no problem. My doubt was that if I could have another insurance from another.
You absolutely can. I can't tell you no. You absolutely can.
It's just that in some places they ask you to be in the Canada like public system, and I'm not sure if we are because in the webpage it says we have the OHIP insurance.
No, you don't have OHIP. You don't have OHIP. You have an OHIP alternative. It's just a name we call for it. So you are not in the Ontario Health Insurance Plan. You are in a separate insurance coverage, and we just name it OHIP Alternative because it's an alternative to the Ontario Health Insurance Plan.
Okay, that's why I was confused because I saw OHIP and okay. Thank you.
Of course. Someone says, does it mean we can change the plan per semester or for 2 semesters? No, you are not able to change your plan per semester. It's per policy year. So you would change your plan within the start of the school year for you. So if that was September, you would change it then. And you are not able to change it until the next school year. You opt in family on the website. You would receive an email saying that your payment was received, and then you would receive another email probably a couple of weeks later with the information on how to move forward with your family coverage. Someone said, does it cover vacations? So there is travel coverage included. That's the travel coverage. So you have travel coverage for any emergency medical assistance that you need outside of Ontario, and this does not include your home country.
That was my
someone else
question.
Said, one second, Paula. So someone also said for the health insurance plan, can we also visit the dentist or is it not included? So as I said, there's two different health plans. So there is a general health plan that everybody is automatically enrolled on. And then there was a dental focused plan. So if you changed to the dental focused plan, then you absolutely would have dental insurance. But if you did not change, then unfortunately you do not have dental insurance. Yes, Paula?
My question was about when we go out on vacations, because our studies last, and my studies last until May. But in May, June, July, like summer vacations, are we covered, right?
Right. So as I said, this policy year is September 1st, 2021 to August 31st, 2022. So you will be covered through that entire time. If you ever, are unsure or you just want confirmation, please reach out to our contact center and they'll be able to let you know your exact dates. But as long as you are a full-time student and you've paid all your fees, you would have coverage until August 31st, 2022.
Okay. I only received the receipt of my family opt-in. I didn't receive any other mail. Who should I contact?
You will. And Paula, if you are looking to get it and you feel as though it's been a long time, reach out to our contact center and they'll be able to help you out with that.
Okay.
Okay. All right. If there's any other questions that people might have, or I know sometimes it's hard, you forget at the time and then you want to ask later, just remember that we do have our contact center available every day from 8 a.m. to midnight, and they'll be there to answer any questions. It was really great getting to connect with all of you, and I hope you all have a wonderful day. And as we said, this will be posted on the iSend app. So Tara, I will make sure that I send this over to you as soon as I can. All right. Enjoy your week, everybody. Bye.